Hello everyone, this is Paul from Ortho Eval, and today I want to talk about my 11 best frozen shoulder home exercises. Now before we get started, I just want to let you know that if you are suspicious that you may have a frozen shoulder, it's not a bad idea to talk to your primary care provider, seek some medical attention, because sometimes it could look like a frozen shoulder but could be something else. So it's very important that you try to get some medical attention for this and get some guidance on how to treat this. But some of you have not had a chance to, get to a provider, or maybe are looking just for a little bit of help online. Today, what I'm going to do is show you some exercises that are real simple, light, and easy to do, and can certainly help you treat your frozen shoulder. All right, so before we get started though, I do want to get into some exercises, but I also want to start with what a frozen shoulder is. All right, so you have this ball and socket, okay, at your shoulder, and there's also another joint on top called the AC joint. And what happens is when this ball and socket comes together like this, it has to be held together by something, correct? So there are a lot of muscles that are around the shoulder that help to hold it in place, but there's also this tissue called the capsule, which is almost like a water balloon that encapsulates or comes around the ball and socket, and that allows that ball and socket to move back and forth. It helps to produce a lubricating fluid for inside the joint, and it allows for a lot of mobility. But if that tissue becomes stiff and tight, it will limit your ability to move your arm into rotation, out to the side, or even up in the air like this, okay? So what happens early on is that tissue can become somewhat inflamed and irritated, and when it does, the whole joint really gets stiff and tight, inflamed, irritated, and you can have a lot of pain associated with that. So that is kind of like the early stage of frozen shoulder. Over time, this tissue can become stiffer and stiffer and stiffer, and you can really lose your range of motion and have some limited mobility along with your pain. So one of the things that predisposes a person to a frozen shoulder is that you could be diabetic. If you have a thyroid problem, that also puts you at high risk of developing a frozen shoulder. There is a big hereditary component to this also. So if you have a mom and dad that have both had a frozen shoulder, it's pretty likely that you could get one. One of the things that I've seen with my experience, and I've been at this for over 30 years, and I've seen a lot of people with frozen shoulders, is that if you get it on one side and it gets better, it's likely that you're going to develop it on the other side, but maybe not on the same side that you started to have the frozen shoulder on. So what I want to do is talk about some of the people who are at highest risk of developing a frozen shoulder. If you are diabetic, if you have a thyroid problem, those are all contributors. If you have a family history, so we are starting to learn that people who have a history and a hereditary predisposition are at a greater likelihood of getting a frozen shoulder. All right, people with hormonal changes, so people going through menopause, or people with a big fluctuation in testosterone, can also be at higher risk of developing a frozen shoulder. Now, usually a frozen shoulder will develop slowly and progressively over time. It can happen from trauma to the shoulder, or some sort of an underlying problem that causes that tissue to flare up and then ultimately become really stiff and tight. Now, when you have a frozen shoulder, it usually starts very slowly, and it usually starts with acute pain. So it really doesn't matter what motion you're going into, you're going to start to develop some really early discomfort in that shoulder. Now, it's very uncommon for us to see anybody, within 2 to 3 months of having a frozen shoulder, because that first part is just an acute inflammation and it causes pain, and everybody thinks it's going to get better until you go to quickly reach for something and it just puts you to the floor, or you can't put that jacket on anymore because you're having a hard time turning that arm. And so that can make it quite difficult. And then that's usually when somebody seeks medical attention to find out that they have developed a frozen shoulder, or they're starting to develop a frozen shoulder. Now, the first thing you need to understand if you have been given the diagnosis of a frozen shoulder is that these take a long time to get better. They do not get better overnight. If it does get better overnight or within a couple of days, you probably don't have a frozen shoulder. The other technical term to this is adhesive capsulitis. So adhering of this capsule tissue around your shoulder, and it starts with inflammation. But As time goes on, you have less inflammation in the shoulder and you have more of a stiffening and tightening and loss of motion. So it's important to understand that when you get this, it is going to take a long time to get better. Now, as I said earlier, I've been at this for over 30 years as a physical therapist, and I've seen a lot of frozen shoulders. The good news is that they typically get better. I would say 95 to 98% of the frozen shoulder patients that I've seen have gotten better. Those who've had the most challenging times were those who were perimenopausal, who were diabetic, and who had a thyroid problem. And even people who have had open heart surgery are at higher risk of developing a frozen shoulder afterwards. And we've seen people with all of those, and basically the perfect storm to develop a frozen shoulder and have it last a long time. But most people do get better, and that's the promising part. The downfall is that it takes a long time for it to improve. But getting guidance with a physical therapist or occupational therapist can be very helpful. Seeing an orthopedic surgeon, getting x-rays to make sure that there isn't an underlying arthritis is also very important. Most people with frozen shoulders don't have a significant problem with their rotator cuff. So over time, that rotator cuff will become weak because you're not using the arm as much. But that's why you should be in some sort of a guided program to help start to activate those shoulder muscles and start to develop some gentle stretching and progressive mobility in your shoulder so that you can have function in the long haul. So with that being said, we are going to jump into some of my favorite exercises that I like to send patients home with to help stretch themselves and to help slowly gain strength and range of motion. I'd like to talk about some of the common signs and symptoms of a frozen shoulder so you have a better understanding what to look for if you suspect that you have one. Usually what happens is the pain comes on progressively over time. Sometimes can happen after an injury, but oftentimes will just happen on its own. That's kind of the classic sign of a frozen shoulder. Typically the pain is throughout the shoulder. It's not just isolated to one area, the front or the back or the side, but typically people will report the pain as being really deep in the shoulder and occasionally more out to the back side. The other thing that you'll find is that if you try to lift your arm and you cannot get it up on your own and somebody else tries to push it up or you try to push it up with the other hand, you can't get it up much further. And that can happen with all of the other motions, even turning the arm out to the side like this. If you can only turn it out to a certain distance and then try to push it and it won't go further, then that's a pretty good sign that you have a frozen shoulder. Now, most people lose mobility in all positions. So they lose the ability to lift the arm up and to lift it out to the side. They have a hard time turning it out, and they have a hard time reaching behind their back. So tucking in a shirt, putting on a belt, snapping a bra can all become very, very difficult. And usually that back motion is very painful also at first. So those are your most common signs and symptoms that you have a frozen shoulder. So everyone, what I want to do is I want to start with some real light exercises. So if you are in the early stages of a frozen shoulder, there's a lot of acute inflammation, it might be quite painful, you can start with some light exercises. And in the past, you used to try to push through all of that as hard as you could. Now we're telling people it's a low load for a long duration. And try to find that comfortable range. You can have a little discomfort, maybe a 2 to a 3 on a 0 to 10 pain scale, but it shouldn't be an extreme amount of discomfort, because if that happens, you're going to spasm up, and if you spasm, you're also going to limit your range of motion, and the spasm alone can be quite painful. And they've done some great studies to show that if they put you to sleep when you have a frozen shoulder and they check your range of motion, that it's going to be better while you're under anesthesia, just because you're not fighting it as much and because it's not as painful. So we know that sometimes it's not just that tight capsule that's limiting you, but it can also be that apprehension. So trying to relax when you do these is going to be very important. So first exercise I like to do is a little external rotation stretch. So I always get a towel that's 2 to 3 inches thick, and I put that under the elbow, because when the arm is in this position 45 degrees away from the body. It's in its most relaxed position, okay? Then I have you take a cane, and it could be a dowel, a broomstick, whatever it might be. And what you do here is you try to keep the arm away from the body about 45 degrees, and you try to maintain a 90-degree angle at your elbow. So what you're trying to do here is use this hand to try to push the affected side. So what you're doing is you're pushing it straight back, maintaining that 90-degree angle at the elbow. And this is where people go wrong. They usually start to push, they get some discomfort, and they straighten out the elbow, and we don't want to do that. We're not trying to gain elbow range of motion because the problem isn't there. We really want to try to get isolated shoulder range of motion. So here, you would take a hold of the cane. I always tell people the other hand should be over the belly button. That really is a good landmark. And you're very gently pushing back. Now my right arm is completely relaxed. I'm hitting a little bit of restriction. That's if I would have a frozen shoulder. And I'm just holding that nice gentle stretch for a 15 to 20 second count if I can. I don't want it to get too painful. Then I relax and I have it come back. All right, I might have the patient do that 4 or 5 times in a sitting and do this 2 or 3 times a day, just to try to help increase that range of motion, that rotation. Now, I always like to do rotation because in order to get good flexion or abduction, you need to gain good external rotation. It just helps to clear the bones here a little bit better and not cause so much pinch in the shoulder. The next exercise I like to do is just a overhead cane flexion exercise. So again, with your cane, you grab a hold of it like this. I like to hold it on the end like that and not like this because again, that causes more pinch when you go overhead. So it clears it a little bit better if you can keep that hand like this on the end of the cane. What you do is you slowly bring that arm over the top. The left arm is doing most of the work. The right one is going along for the ride. Once you start to hit some restriction, you can hold that there very, very slowly and lightly. Take your time with this. Shouldn't be severely painful. Once your 10 to 15, 20 seconds are up, you can come back. Now, I sometimes will have them hold up to 30 seconds if they can tolerate this, but if it's too uncomfortable, you don't need to hold it as long. We're just looking at trying to gain range of motion, right? Okay, so then you come back. It's a nice, gentle stretch. Again, your pain should be no more than a 2 to a 4 on a pain scale of 0 to 10. And then you return back to this position. Now, while you're in this position, I also like to just turn the muscles around the shoulder on a little bit. So I like to do internal and external rotation actively, which means that you're doing it yourself. So again, this arm is in this nice relaxed position. And you're just trying to turn it in, turn it out. Imagine there's a pin on the end of your elbow, and you're just turning it in, turning it out in the range that is comfortable. So whenever you have a frozen shoulder, you'll know exactly what I'm talking about. It's going to be limited coming in. It's going to be limited going out. And here, I might do like 3 sets of 10 repetitions in that comfortable range, just to try to gain some confidence in the motion that you do have. So the next couple exercises I like to do are with the table. And they're going to look pretty simple, but I'm telling you, if you have a frozen shoulder, you're going to very much understand how and why these are so important, okay? And that even though they look easy, they may not be. So an exercise that I like to do, especially after shoulder surgery and with patients who have a frozen shoulder, is the pendulum exercise. And so basically what you're doing is the good arm is on a table, or it could be on your knee like this. And what you're doing is you're swinging the body forward and backward, and the arm is going along for the ride. All right, real simple, just like this. If I were to stop my body from swinging, my arm would slowly come to a stop. All right, I am not making my arm go forward and backward like this. I'm utilizing my body to do that. Okay, this is called the pendulum exercise. You can even do it side to side like this by swinging your body side to side. The arm goes along for the ride. If I were to stop my body, the arm just comes to a nice gradual stop. Now, this is important. If you swing that arm too hard and it goes up and it hits the end of that range, that's going to be quite painful and can cause some irritation and inflammation. So be gentle at first. Just try to find the range that works for you. You can do this 3 sets of 15 in each direction, side to side and forward to back. As long as you keep it in that range, even if it's very small like this, that's fine. As you get better, which you will, that arm is going to start to go a little further and you're not going to have a lot of trouble with it. All right. Another range of motion exercise I like to do is real simple. You get a table that's next to you. It could be a countertop, whatever it might be. And you put your hand on it like this. And this is to help gain some extension or the ability for your arm to go behind your back. All right. So all you do is you keep the fist on the table with just a very light amount of weight on it. And then you step forward. You can see how the arm goes behind me a little bit and then step back. And so you just start nice and easy in this range here. As you feel like you're getting better and you're not so uncomfortable, you can go a little further and just work that arm kind of in a passive way, but putting a little weight through your arm. And that can also help in the early stages of a frozen shoulder. Now, even in the early stages of a frozen shoulder, it's still okay to exercise and work on building your strength. I always tell people you can utilize your arm in whatever position you feel comfortable in as long as it's not causing an extreme amount of pain. All right? So you can still function and do a lot of your activities. A lot of people get worried about it and think they have to put their arm in a sling, which is the absolute worst thing you could possibly do if you have a straightforward frozen shoulder. All right? So in this early section where we have still this acute inflammation, it's uncomfortable, it's okay to do some light strengthening exercises. So I like to teach this next little series of exercises are called 4-position isometrics. And what we're doing is we're making the muscles around the shoulder contract, but not putting the shoulder through a lot of motion. So it really shouldn't be painful while that muscle is contracting. All right, so the first one we start with is called flexion. Basically, that arm is by your side. You take your other hand, and you can do this up against a wall if you wanted to, or a post or something like that. That's fine. But what you're doing basically is you're putting your other hand in front of the fist, and you're trying to push forward, but you're resisting it and pushing back. So basically, the right arm is trying to go forward. The left one is holding it from going. You hold that for 5 seconds and then rest. Do it again. 5 seconds. Rest. 5 seconds. And I typically have people do all of these exercises, each of the 4-position isotonics or isometrics, 3 sets, 10 repetitions if they feel comfortable and they want to do that. Now the next one is called internal rotation. So basically the arm is next to your side. You're taking the other hand and trying to push against it. So this hand, the side of the frozen shoulder, is going to be turning inward, and you're trying to resist that with the other side. 1, 2, 3, 4, 5, and then rest. 1, 2, 3, 4, 5, till you get to 10. Then the next one I like to do is external rotation, turning outward, which is very important in regards to how your shoulder functions down the road. You need to remember, if you've had inflammation and pain and loss of motion with this frozen shoulder, if you're not lifting that arm up overhead, those muscles are not working a lot, and they're becoming weaker and weaker and weaker over time. So it's okay for us to do these activities to help build the strength. Now we're trying to turn the hand out that way. So we're going to use the good arm to hold and resist it. 1, 2, 3, 4, 5. And I'm pushing, probably 10 to 15 pounds of pressure, but you can push as much as you feel comfortable as long as it's not hurting more than a 2 to a 4 on a pain scale of 0 to 10. And again, 1, 2, 3, 4, 5. Now the last one is elbow extension or shoulder extension. We're going to be trying to pull the arm back. This is easiest if you can get up against a wall or a post and push back into it. You can, though, resist yourself with the other hand. So what I'm trying to do is I'm trying to pull back, and I'm going to hold 1, 2, 3, 4, 5, and rest. 1, 2, 3, 4, 5. So those are the isometric exercises that you can certainly start doing anytime in the course of your frozen shoulder. Now, as time goes on and you start to get better and maybe you're not having so much discomfort, but maybe the arm is just feeling stiff and tight, you can start to progress yourself a little bit more. So that cane stretch that we did over the top, you can add a little ankle weight to it. And you're doing the same thing. You're grabbing the cane with the hand on the edge like this, and you're reaching overhead. The idea here is to keep the elbows locked out and nice and straight. A lot of people have this tendency to drop the arm away from the head. Try to keep them as even to the head as possible. So you're going straight back just like this. Holding that stretch 20 to 30 seconds now, trying just to get a little bit more out of that flexion. Flexion is an activity we need in order to get overhead and do a lot of activities. So it's an important one to get back. Now this next exercise is one of my favorites for frozen shoulders and for anybody who needs to increase that shoulder motion overhead. I just call it a bar lunge. Basically you take a dowel, broomstick, whatever it might be, and you put it on a table in front of you. You can do this, if you're on the floor on your hands and knees and putting the dowel on the floor, that's fine. I like to do it on a table because I like to be able to get into this lunge position and really have a lot of control from my legs, okay? So I have the patient usually hold the cane like this, and if you want to use the good arm just for balance, you can do that and put it on the cane. But what I'm looking for here is I'm looking for this arm to start to go up a little bit and stretch ahead. As you can see from this angle here is starting to increase. Okay, right there. And I'll have them hold that stretch. Now, the beauty of this stretch is that not only is the arm going up, but as you're dissipating the force, you're getting this pull from the bar that is tractioning the arm, which I really like to do when it comes to lifting the arm overhead. Okay, so this is a nice transition into what we call a bar hang, which we're going to be doing in just a little bit. Once you've done 3 or 4 of these and you're comfortable, take the hand, put it a little bit higher. Now make sure that it's not too slippery so your hand doesn't slide down. You want to keep it there. And then again, you're lunging forward. And you can see how that is getting that arm to go up a little bit higher. After I've done 3 or 4 of those, I might grab that bar up a little bit higher like this. And again, lunging. And you can see where I'm getting that traction effect right here. Okay, as I'm getting that nice stretch. And patients really like this. It's a great way to get that mobility back. Oh, I love this next exercise. This is one that I do with a lot of my patients. It's called brachiating or bar hangs. The reason I like it is because the patient is in complete control of the stretch with their legs. And you get a little bit of traction at that shoulder while it's going up overhead. There are, different ways of doing this, but this is the way I like to do it. If you cannot reach a bar or something that's overhead, let's say this arm just doesn't have enough motion, use a step stool to get on, and that will help to get you up a little bit higher. But basically, if you need to, grab a hold of that bar, make sure it's comfortable. I like to go, as wide as you can go to start with. And what you're doing is basically just bending at the knees and hips and allowing the body to go down while that arm is getting a nice stretch. Now, a lot of people will end up doing this, okay? So it's good to put them in front of a mirror so that they cue themselves. They can get down nice and straight with this and get this nice long stretch to that arm, which is just gonna help with that overhead mobility. I like to hold this for 30 seconds. Once they're done their 30 seconds, they stand up. They'll have to let that arm down because if it's a little irritated, it might just drop. So you can help it down and then help it back up. Again, you're squatting at the knees and hips, getting that nice long stretch. As they get better, they can bring the hands in a little bit closer If they can't tolerate this position, then use a bar that holds like this, or even like a TRX strap that goes in that position might make that a little bit more comfortable. But that's brachiating or a bar hang, super exercise to optimize that shoulder flexion. One exercise that I haven't really talked about much is internal rotation, or the ability to turn that arm inward behind your back. Early on, this can cause a lot of irritation to that shoulder, so I kind of go easy with this, all right? But it is important to get back, because you still need to be able to tuck your shirt in, snap a bra on, pull your pants up, and wash your back, and do activities like that. So it is important to get that motion back. So the way I like to do this is I usually take a towel or some sort of a strap. If it's going to be a piece of TheraBand, it needs to be nice and taut and not too rubbery. So the first way I start this is I just bring the arm back there, and I put that towel in each hand, and I just gently work on pulling the arm towards center to start with. And I might hold that stretch for 15 to 20 seconds. It's very gentle, it's gradual, it's not real aggressive, and you're just trying to get that arm to here. And I know that can be quite difficult at first, but it does get better over time. And as that does get better, then what you do is you sling the towel over the back, grab a hold of it with the hand down here, and you're slowly going to lift that hand up toward the center of the back. Many people will pull up toward the armpit. That's not what we're looking for. We want to get the hand toward the center of the spine, slowly lift up toward the back. Once you find that comfortable range where you're getting that gentle stretch, about 2 to a 4 on a pain scale, you think you can hold that for 30 seconds, just pull the towel over the back, over the stomach, and then just hold it there for a little bit. Once your time is up, you let that arm down, give yourself a little rest, shake it out, grab it again, pull back up. It's another hold for 30 seconds. I usually have people do 4 or 5 of these to help gain that internal rotation. So a nice little stretch to do to be able to reach behind your back. As you've noticed, a lot of these exercises are really easy to do. It doesn't require a lot of equipment, and that's the whole idea here. You don't need to be in a fitness center, but these are things that you can easily do at home. So I hope that you're enjoying them. If you do, give us a thumbs up. I'd really appreciate that. That just helps to bring other people to our channel so that they can get some help with their frozen shoulder and get some exercises to help with that also. So this next exercise is a really easy one, but can be a little bit painful. But you get 3 different motions all at one time, and it can be done if you're in a recliner or maybe just laying in bed. So what you do is you go right onto your back, clasp your hands, bring those hands behind your head, and then work on letting the elbows drop. Okay, once you get to that point where you feel a good stretch, just hold it there 20 to 30 seconds, and once your time is up, bring those elbows back up and try to squeeze them toward your face, because you do need to stretch the back side of that shoulder also. And this is a nice way to do that. So you're squeezing the elbows together. Again, same amount of hold. Once you're done there, slowly go back down. Let those arms really relax. Let them go down nice and easy. Get a good stretch. It's a great stretch. You could do this just about anywhere. And I usually do about 4 or 5 of those stretches right there. And that helps to get a combination of different motions all at one time. All right, folks. Well, I hope you enjoyed today's video. Remember this, frozen shoulders take a long time to get better. You need to be patient. You need to not push through it too hard. Getting guidance from a medical provider is super important. Make sure that you rule out everything else that can look like a frozen shoulder. I wish you the best success. If you do have a frozen shoulder, take it easy and tell your friends about us, and be sure to subscribe. Thanks.